Have you ever looked down at your feet and wondered if they might be trying to save your life? Most people believe heart failure begins with dramatic chest pain, a sudden collapse, or an emergency trip to the hospital. But after treating thousands of older adults over the years, I've learned something very different. In many cases, the first warnings don't come from the chest at all. They come from the feet. And sadly, most people ignore them. A few months ago, a 73-year-old patient came into my clinic. He wasn't worried about his heart. He wasn't experiencing chest pain. He wasn't short of breath. His only complaint was that his feet felt unusually cold at night and his ankles seemed a little swollen. He assumed it was simply aging. 3 months later, he was hospitalized with advanced heart failure. Looking back, the signs had been there all along. His body had been whispering for help. The problem was that nobody was listening. Today, I'm going to reveal 12 warning signs that may appear in your legs and feet when your heart begins to struggle. Some of these symptoms may seem harmless. Some may even sound completely unrelated to your heart. But together, they can tell a very important story. And make sure you stay until the end because symptom number 9 affects a surprising number of heart failure patients, yet most people never connect it to their heart. Before we begin, welcome to Healthy Wisdom for Seniors, the channel dedicated to helping adults over 50 protect their health, preserve their independence, and live longer, stronger lives. If you value trustworthy health information explained in simple language, subscribe now and turn on notifications. Every week, we share life-saving insights that could help you recognize a problem before it becomes an emergency. Now let's begin with the first warning sign. Constantly cold feet. If your feet remain cold even when the rest of your body feels perfectly comfortable, your heart may be sending an early warning signal. When the heart becomes weaker, it cannot pump enough blood to every part of the body. To protect vital organs such as the brain, lungs, and kidneys, your body redirects blood away from less essential areas. Unfortunately, your feet are often first in line to lose that circulation. This is why many patients describe their feet as feeling cold from the inside out. Unlike ordinary cold feet that warm up after movement, these feet stay cold regardless of temperature, socks, or blankets. The second warning sign is swelling that leaves a dent. If you've ever pressed your finger into your ankle and noticed a depression that remains for several seconds, pay attention. Doctors call this pitting edema. It happens when fluid builds up inside the tissues. As heart function declines, blood begins backing up inside the veins. Pressure rises, fluid leaks into surrounding tissues, and swelling develops. Many people assume swollen ankles are simply part of aging. But when swelling becomes persistent, it may be one of the earliest visible signs that your heart is struggling. The third warning sign is unexpected leg weakness. Have your legs started feeling heavier than they used to? Do stairs seem harder than before? Have simple daily activities become surprisingly exhausting? Your muscles depend on oxygen-rich blood to function properly. When circulation decreases, your leg muscles receive less oxygen and fewer nutrients. Over time, they become weaker. Patients often tell me, "Doctor, my legs just don't feel the same anymore." They describe their legs as heavy, tired, unstable, or lacking strength. What many don't realize is that the problem may not be in their legs at all. It may be in their heart. And what comes next may be even more important. Because the fourth warning sign often appears suddenly and catches people completely off guard. Rapid weight gain. Imagine stepping on the scale and discovering you've gained 5, 7, or even 10 pounds in only a few days. Most people immediately blame food. But heart failure often causes rapid fluid accumulation throughout the body. This extra fluid settles in the legs, ankles, feet, and abdomen. Unlike fat gain, which develops gradually, fluid retention can happen remarkably fast. If sudden weight gain occurs alongside swelling, your body may be telling you that circulation is becoming compromised. Warning sign number 5 is a change in skin color. Look closely at your feet and lower legs. Do they appear bluish, grayish, or darker than usual? This discoloration can occur when oxygen levels decrease and circulation slows. As blood struggles to move efficiently through the body, oxygen-poor blood begins accumulating in the extremities. The result may be a bluish tint that starts in the toes and gradually spreads upward. This is not merely a cosmetic issue. It's a sign that your tissues may not be receiving the oxygen they desperately need. Before we continue, I want you to leave a comment below. Have you ever experienced swollen ankles, cold feet, or unexplained leg weakness? Your experience may help someone else recognize an important warning sign before it's too late. And keep watching because symptom number 7 is one of the most overlooked signs doctors worry about the most. The sixth warning sign is persistent ankle swelling. Unlike occasional swelling after a long day, heart-related swelling tends to return again and again. Many patients notice a pattern. Their ankles look relatively normal in the morning but become significantly larger by evening. Socks leave deep marks. Shoes feel tighter. Walking becomes uncomfortable. This daily cycle often reflects fluid retention caused by a weakening heart. The seventh warning sign is slow healing wounds. This is one symptom that should never be ignored. Imagine getting a small cut, scrape, or blister on your foot. Normally, it should heal within days or weeks. But when circulation becomes impaired, healing slows dramatically. Oxygen, nutrients, and immune cells can no longer reach the injured area efficiently. As a result, wounds linger far longer than they should. Some patients struggle with sores that remain open for months. If a wound refuses to heal, it may be revealing a serious circulation problem hidden beneath the surface. The eighth warning sign is leg pain while walking. Have you ever noticed aching, cramping, or heaviness in your legs after only a short walk? Perhaps you find yourself stopping frequently to rest. This occurs because physical activity increases the muscle's demand for oxygen. If your heart cannot deliver enough oxygen-rich blood, discomfort follows. At first, symptoms may appear only during strenuous activity. But as heart function declines, even simple walks across a parking lot or through a grocery store may become difficult. Now we've reached the symptom that surprises almost everyone. Number 9. Restless legs at night. After a long day, you finally lie down hoping for restful sleep. But suddenly your legs begin tingling, twitching, cramping, or demanding movement. You can't get comfortable. You keep shifting positions. Sleep becomes impossible. Many people assume this is simply a nerve problem or part of aging. However, heart failure can contribute to these sensations. During the day, fluid accumulates in the legs. At night, when you lie flat, that fluid redistributes through the body. This shift can irritate nerves and create the uncomfortable sensations known as restless legs. The result is poor sleep, chronic fatigue, and declining quality of life. Warning sign number 10 is worsening varicose veins. If your varicose veins suddenly become larger, more painful, or more noticeable, don't dismiss the change. Heart failure increases pressure throughout the venous system. This additional pressure places enormous strain on already weakened veins. Over time, veins enlarge, twist, and become more prominent. Many patients report that veins which were once merely cosmetic suddenly become painful and troublesome. The 11th warning sign involves changes in the skin itself. Does the skin on your lower legs appear shiny, stretched, or unusually smooth? Excess fluid beneath the skin causes tissues to expand. As the skin stretches, its normal texture begins disappearing. Doctors often recognize this glossy appearance as a visible clue that significant fluid retention is occurring beneath the surface. Finally, warning sign number 12. Numbness and tingling in the feet. Many older adults assume these sensations are caused solely by aging or diabetes. But poor circulation can also damage nerve function. Fluid buildup may compress nerves, while reduced oxygen delivery can deprive them of the nutrients they need to function. The result may be numbness, tingling, burning sensations, balance problems, or the feeling that your feet are constantly asleep. Now here's what I want every viewer to remember. Having one symptom does not automatically mean you have heart failure. But when several of these warning signs appear together, especially if they worsen over time, your body deserves attention. Heart failure rarely appears overnight. Most often, it develops gradually. The body whispers before it screams. And very often, those whispers begin in the feet. That's why awareness matters. That's why education matters. And that's exactly why Healthy Wisdom for Seniors exists. Our mission is simple: help adults over 50 recognize health threats early, take action sooner, and enjoy more healthy years with the people they love. If today's video helped you, subscribe to Healthy Wisdom for Seniors, give this video a thumbs up, and share it with a friend or family member who may need this information. And before you leave, tell me in the comments, which of these 12 warning signs surprised you the most? I read every comment, and your story may help save someone else's life. Thank you for watching. Stay healthy, stay informed, and remember, your body is always communicating with you. The question is, are you listening?